For 90 years, the American Academy of Pediatrics has been a voice for children. These principles laid out so many decades ago remain critical today. As we remember what we have achieved in our past, we must also acknowledge the remarkable work being done in the face of today's challenges.
Well, COVID-19 has challenged every facet of our profession and called forth our survival skills.
So it was a really tough balance between trying to get our patients in safely, making sure that the families felt safe to come in to get their vaccines.
I think without the ability of turning to the academy, things would have moved much more slowly for pediatricians. It's a great kudo to the academy in its ability to be able to get information almost instantly to practicing pediatricians.
Before the AAP was founded in 1930, children's health in the United States was often an afterthought. The influenza pandemic that followed World War I and the unimpeded spread of other infectious diseases like measles and polio meant the mortality rate for children born in the 20th century was tragically high.
The state of child health in 1930 was abysmal, and that observation was acknowledged by the leadership of the country. The infant mortality at that time was about 10 times what it is today. They launched the American Academy of Pediatrics to respond to the lack of progress in addressing these child health problems.
The Academy paved the way for numerous innovations in pediatric practice, care, and research. That innovative spirit remains today in the face of a global pandemic.
I've seen, and my colleagues throughout the country have innovated through giving vaccines or providing care in the car, from the parking lot, also setting up tents.
Pediatricians are using more aggressive and creative outreach to reassure parents and to get children in for their well child checks and vaccinations.
It's to the credit of the academy that we have members and committees and councils who are always working on some aspect of pediatric practice that is far beyond just making a diagnosis and prescribing a treatment.
That tradition of research and innovation carries on today in the midst of a global pandemic and with the battle against systemic racism.
A privilege of being a pediatrician is seeing the development of a child from birth to young adulthood and really developing that relationship with the family and developing a continuity of care.
Pediatrics is an incredibly optimistic specialty area, and I think that's really what attracted me to pediatrics.
And we'll have new challenges tomorrow, just as we've had in the past, and we will succeed.
With the health, safety, and well-being of children at the forefront of all we do, we will continue to innovate, evolve, and lead, today, tomorrow, and in each decade to come.